Yes, I am Sister Dr. Fausta Liundi, a medical graduate from Dar es Salaam in 2010. I am a sister of Santa Benedict's Order, working in Santa Walburg's Hospital in Nyangao, which is located southeast of Tanzania, Lindi. Yeah. So I'm going to present practical ideas which facilitate work in my hospital. Okay. So many things. Yeah, the hospital was established in 55 years ago by the missionary Benedictine sisters of Tuzing, Germany, and the hospital is owned by the Diocese of Lindi, and in the other part it acts as a district hospital, and as such it receives some government funds. Since we have a resident surgeon qualified, many patients with complicated surgical problems are referred to our hospital. The patients come from hospitals in Lindi and Mtwara region. These regions have a population of 202 million people. As well, we get referrals from neighboring country, Mozambique, which is 100 kilometers to the south of Nyangao. The patients coming to our hospital have difficult neglected surgical problems, severe postoperative complications. There is a rapidly growing group victims of road traffic accidents also. We are working under a rarely low resource setting with permanent shortage of educated personnel, doctors and nurses. There is chronic lack of money for drugs and medical materials, and at the same time constantly growing number of patients asking for treatment. Since the situation creates a dilemma for us and forces us to become innovative and creative in order to keep our costs down and provide uninterrupted medical service, here are some of the solutions we have found. A safe, sustainable outpatient department pharmacy was established with donation from Action Media, German medical NGO. The OPD pharmacy financing is independent from many pharmacy budget of the hospital. The pharmacy purchase drug and the medical supplies which are not available in the main hospital pharmacy and sells them to patients at small profit. This practice allows the pharmacy to be self-sustaining. For many years we have been using polyethylene fishing line instead of expensive suturing materials such as Sagelon for non-absorbable sutures in skin and fascia. We have not seen any negative side effects. This costs about 1/5 times less. Here are some of the nylon samples which we are using in Nyangao. You can pass them and see they are in a different size. 0504. They are in the just over. Getting proper antiseptic solutions for hand scrubbing and other topical applications can be difficult. We overcome this problem by mixing povidone iodine with dishwashing detergent in a ratio of 3:1. For Parkinson's tibial traction cases, we have modified some of our beds in the hospital workshop. The lower part of the bed springs and of the mattress can be removed. We also created our own type of weights and bed elevators. So the patient, to avoid knee contracture, is doing exercise of the knee after removing that part of the bed. We have designed more practical hangers for drip solutions to replace the traditional stands in the major operating theater and the ICU, as we see, by using our own materials from the workshop. Colostrum bags are expensive and hard to obtain in our place. We make our own from readily available plastic market bags, which are heat sealed using a gas lighter. They are attached to the skin with latex glue used for car inner tube repair. The effect is very satisfactory and there are no negative skin reaction. The cost is about 6 times less.
What kind of plastic is it?
There are samples of the plastic which we are using here.
Where do you normally use this plastic for?
For colostrum, we are
On the market, you buy it.
we are buying from the market. So
And you buy it for
you measure
nuts.
the size of the wound, then you cut it. And apply glue. You put.
On the market for vegetables or for
Yeah, they are using for different purpose in the market. So we are using that. We send our tissue samples to German's Praxis Pathology in Stubborn, Germany for histological examination. We now use small, strong plastic tubes originally intended for laboratory blood sample. They are filled with formalin and well sealed. The tubes are placed in irregular stamp envelopes and mails. The results are received digitally encoded over the internet after 3 weeks or so. Here are some of the examples how we send our tissue to Germany by using that envelope. We do not have a modern ethylene dioxide sterilization system. To sterilize items that cannot withstand high temperature, we use a formalin evaporation process. Blood irrigations or those conditions that have a significant urine outflow can result in urine bags that overfill quickly. In order to avoid this problem, we have developed a system using simple wooden stands that hold ordinary plastic bottles. This simple system is easy to use, as you will see in the. Our patient files used to be kept in plastic folders. These were not durable. We replaced them with aluminum clip posts of our own design made in the mission workshop. They are stored in wooden boxes on mobile roll of our design and used by the doctors on their rounds, as you see. Our old electrical dermatome, which had been repaired many times and then permanently damaged, had to be replaced. We replaced it with a simple dermatome specially designed for developing countries by the Dutch company Humeka. It has been tested in Tanzania hospitals and performed well. A higher number of wounds are contaminated by dust, soil, grass, or other material and infected. We have to use a simple but effective treatment such as meticulous debridement, irrigation with tap water, under pressure, and restricted pressure for air and elevation of injured and infected limbs to achieve good result. In short, diving, debridement, irrigation, ventilation, elevation. I have been presented some of inventions and ideas that facilitating work in surgical department of Santa Walburg's Hospital, Nyangao in Tanzania. I hope that some of this would be helpful in other hospitals working in low resources settings. These are some of our staffs. Lucky enough, Dr. Maraya was together with us in Nyangao, as we see. Thank you very much.
Thank you, Sister Fausta. Maybe some questions. Professor Lule.
Yeah, I'm intrigued by the urine bag that you developed. Because I assume you don't sterilize the bottles before using them. And if so, is there an increase in urine tract infection using those bottles?
We haven't seen it up to now. We are using it, and these bottles they are used to put safe water. So it's not much contaminated in there. Our thoughts is clean and no contamination in that bottles.
So you use the bottles fresh from shelf with the water in. You just decant the water and then turn it into a urine bag, or do you use a used
bottles? We are using a used bottles after emptying water, and then we put.
Dr. Yank, did you want to support?
Maybe I will answer this question. There's simple reason to use bottles, and somebody can be surprised, because sisters show many very simple things, but the simple things are helping us to work. First, colostomy bags, which are not available. It costs 150 times more than our simple plastic bags that people use it. We teach them how to use. And why bottles not? It's a special idea not to use a urinary bag, because if you have patient after VVF operation, and you know this nursing care is not ideal, not to say it's not very good during the night, then bag is full of urine, and all your hard work is spoiled, because all this usually is ruptured and is tragic. And this is protecting us, because in the case if during the night the bottle is full, then it's going on the floor. This is not risky. The same problem is after prostatectomy. We are doing suprapubic prostatectomy. And if the urinary bag is growing, and again the rupture is again or bleeding or many other complications. And this very simple thing is helping us to avoid such terrible situation. 2 bottles, again, very simple thing. One is full, you put in another, one is empty. Then this is working many years and working, let's say, with profit for patients and for us also, because we can sleep well.
Thank you, Dr. Yankic. I think one more question, then we continue.
I must commend you for what you're doing, because this is what we need, ideally. 1 or 2 comments. I've been traveling around Africa, and you can repair a vacuum drain very easily. In case you've done an operation and you need to use vacuum drainage, right? Drainage with vacuum. You take 2 20cc syringes, put a suction catheter with multiple holes into the area that you want to drain. Let's say there is an abscess in the pelvis. Connect it to the syringe, all right? Suck out everything you can, and then at the end, suck it out more, and use the plunger of another syringe to hold the plunger out and strap it. So you've got vacuum in the syringe, and that works very well as a vacuum drain. The second thing I just want to point out is these bottles can, I don't know if it is 100%, there is no science behind this, but they immerse it in jik. It's a local disinfectant that is available very cheaply all over the place, and people have said jik works very well in Africa, all right? Anything, you jik it, they say. For antiseptic. So if you immerse these bottles in a solution of jik, all right, it helps. And I've seen in Bahir Dar recently, these bottles are being used for underwater intercostal drainage. All right, so put a chest tube, connect it to this bottle which goes underwater, all right, and just make a hole on the side of the bottle and put another tube there for the air to come out. So these are innovations which I think are very useful. I must congratulate you on that. And the only fear I have about your colostomy bags is the wound should not get contaminated, because These were tried at one time, and you need really good strapping so that the stoma does not leak and go onto the wound. These are some of the issues. But thank you very much, and I think this is very brave.
Thank you for your comments.
The one question was not answered.
One question
Yes.
was allowed, yeah, okay. Concerning the suturing material, can you say about the percentage you're using the commercial one and the fisherman's line one for your suturing?
How often do you use the fishing line?
I will
Several,
have
almost
sister
all
because we are working
patients
together.
use
Yeah.
for skin and the fashion.
All
all
for
patients.
skin.
All patients.
All
Yeah.
patients.
You don't use any commercial material.
So you don't buy commercial one?
We are using it for those comic materials and this other, but for skin and the fascia we are using this nylon material.
100% since more than 20 years, no single case of side effects, no single case. We are receiving patients from other hospitals stitched by black silk, thick black silk. And silk is not monofilament, it's absorbing pus or fluids, and there's this inflammatory reaction and pass around. Here, never. Some missionaries from neighboring hospitals, including Europeans, they carrying this nylon after hernia operation. Never happened, and single complication. And you know, it is not surprisingly, because this is the same surgeon. This is polyethylene. This is the same what, let's say, graft with mesh graft operation. It's the same material. We've never seen any single complication. Again, coming back to bottles, because it was not answered. The fear that will be infection, because bottles are not sterile. Yes, they are not sterile, but we are forgetting sometimes natural power which is around us. In this case, gravity. The fluid is not going up, fluid is going down. Then it's not ideal sterile, but there is no fear. It will be very long, maybe, etc. But this is rather problem with drain, not bottle.
Thank you.
Can I-
We have to round up, otherwise we cannot.
I think you should do a study on what you just said, and that would be a very good paper, saying that you used normal bottles and then disinfected bottles and sterilized bottles, and then you produce the data. Because saying gravity, I don't think just holds water there. I mean, it's common sense, but we need evidence-based. Thank you.
Can I just add about the nylon suture? This is described in Primary Surgery, Maurice King's book, which I have the pleasure in saying this is a new edition just coming out. Whereas there will be a table which describes the nylon fishing line you have to buy to compare with the size of 2040 needle that you need and its tensile strengths. That one thing that hasn't been described is fixing the nylon to a non-traumatic needle. This is possible quite simply by taking an ordinary injection needle, breaking off the plastic end, putting the fishing wire into the end of the needle and crimping the metal, and this works extremely well. The alternative is using an old-fashioned eye hole needle, which of course makes a bigger hole.
Thank you. Thank you for all your comments. We have to continue. In the tea break we can comment more on all these nice solutions. Thank you, Sister Fausta.
Ongera.
Ongera sana.